Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, we are discussing a very important topic today. We are discussing the importance of telepsychiatry, especially during this pandemic of COVID-19 and how that is impacting psychiatry practices. I have here with me today psychiatric nurse practitioner Michele Novella and medical director of Star Psychiatric Healthcare in Connecticut. Welcome, Michele Novella.
Thank you so much, Dr. Siegel. I'm so happy to be here to be able to discuss this topic in particular today.
Yes, it's so important. I'm going to start with, could you share with us some reasons that you started to incorporate telepsychiatry into your practice, and when exactly did you do that?
So I haven't ever considered myself at the curve of technology in the past. But about a year ago, my practice of 5 nurse practitioners finally decided that it was time to purchase an EHR, electronic medical records system, so that we could do away with charts and have all of our services under one umbrella. And after my amazing office manager, I had a week off, so she dedicated her whole week to researching which program would fit best with our office. She came up with Cario, which is very popular for several providers. And when we got the program running for the main issues that we do, seeing patients in the office, we realized they had an app for telemedicine, and it seemed very self-explanatory and simple. So I met briefly with the other nurse practitioners and said, we see so many college students who are on medications such as ADHD meds, which are controlled substances, of course, and we sometimes can't get to see them for follow-up in the timely way that we would like to. Would we all be willing to try the telemedicine app and see if we can become facile with using it ourselves? Because we're all, not 20. And this is this population is a great population because they are so tech savvy. So we started about 10 months ago seeing our college students for their normal follow-ups, and it was incredibly easy. As soon as I would get them on the screen, I would ask, how was it for you to sign on? Because they either receive an email with a link that they press, or if they're using their phone or a tablet, they download an app called Cario Telemed, and they get a username and password. And then they literally press a button, verify their insurance information, and then they're in a virtual waiting room. And simply that. It's extraordinarily easy for them. I don't know, I guess this generation of young people is just so used to communicating and speaking on a device, watching someone. None of them had problems with it at all. And then we started to think, maybe we can expand this for patients of ours who are moving out of state, because so many people have been moving out of Connecticut recently for financial reasons. And we usually give them 3 months to find a new provider. But in the meantime, would this be a venue that we could offer them until they do find a new provider? Because it would at least decrease one area of anxiety for them. So when this terrible pandemic situation arose, I was so excited, if that's the right word to use. I don't really think it's the right word, that at least we knew how to do this. It was not something that we had to find a telemedicine program for. We already had one that we knew how to use. My office manager we had already watched 2 webinars on how to bill and code for billing a telemedicine visit. And I'll say right here, it's extraordinarily easy. There's not a lot of changes. There's literally 2 sections on the billing and coding form that have to be changed. There's a modifier number for telemed visits, and there's a number where you put the place of the visit. Those are really the two only differences on the billing sheets. And to date, the insurance companies that we participate with have not given us any problem. The patients themselves have been so happy about the fact that we offer it, especially the ones who don't live close by, etc. So after that experience, and with all the recent, I guess, pandemonium, we at least had that in our pocket. And we had patients starting to call in because, we have so many patients with anxiety. I personally have anxiety myself, and I noticed that mine was even getting heightened. So a lot of the patients with anxiety or on special medications that they needed renewed every few months started to call and overwhelm the office with questions like, if we have to quarantine, how will we get in touch with you? Which is a valid concern. So
Right.
Our EHR program allowed us to send out a blast email and a text. I'm going to just go over a little bit of it now because we didn't want patients to become alarmist or frightened by it. It was more to make them feel reassured. So I'll just read ours. To our valued patients, this went out on March 14th. With the heightened concerns of the coronavirus outbreak in the tri-state area, we would like to review with you our plans to ensure that all of our patients continue to receive the excellent, uninterrupted care that you've come to expect and deserve during these potentially confusing times. All the providers at Star Psychiatric Healthcare have the capabilities to offer telemedicine visits with your current trusted provider. These are HIPAA-compliant, real-time, face-to-face video chats similar to FaceTime or Skype, offered through our electronic health records software. This state-of-the-art technology allows us to see our patients and to prescribe all their medications while they are in the comfort of their homes, offices, etc. Telemedicine visits are covered under your current insurance plan and as such are subject to your regular copays and or deductibles. There are no additional fees for this convenient service. Several of our patients who've been seen via telemedicine visits have verbalized their appreciation for this option and have been 100% satisfied to date with this service option. The feedback has been overwhelmingly positive, and patients repeatedly tell us how simple it is to access the visit through an emailed link that was user-friendly and easy to understand. And basically then we give the office manager's cell phone line, because we have an office cell phone line, and our landline, and we tell them, they can contact us any time of the day. We won't take more than 24 hours to get back to them at the most. And honestly, that was such a wonderful thing to do right out of the box, because soon after that, we all decided that working in the office had become unmanageable. We were having patients wait in their car, actually, text the secretary that they were here, and we would clean and scrub down the office chair, in everybody's office, and Lysol the room, because, we're not really sure at that point what we're dealing with, and then text the patient to come up, and they would have to come up alone with no visitors. And it sort of just became too much. And then I think it was maybe March 15th or 16th that we decided that we would all do our visits remotely from home. And it hasn't been, I think a lot of other providers, I have 5 therapists that work and sublet space out of my office, and none of them had telepsychiatry capabilities. But I'm happy to say that they were able to find programs that fit their budget. I know one of them, especially here in the Northeast, was DoxyMe, DoxyMe. I actually, out of my normal paranoia, decided we should probably have another telemedicine program in case our first one didn't work, which is silly, but that's how I operate. And so that one was Zoom. And Zoom, for many people who have heard of it, is very popular in academia as well as in the business sector. It's more new to the healthcare field in general, but they are HIPAA compliant. I can tell you that I read a little bit about them and I filled out a form and basically gave them my credit card. And the next day we were part of Zoom. And we haven't used it yet, but from all the teachers that I do interface with, they said it's excellent because for people who want to have a group, you can have several people online at once and you're able to see them. So that might be something in the future that we look at as well.
Excellent. Given the pandemic that we are currently faced with in the wake of COVID-19, there's obviously a rising need for mental health services, as you sort of touched on. And so how has telepsychiatry helped you in your practice and helped your patients in the midst of this epidemic?
It's such a good question, Dr. Siegel. Number one, I think letting our patients know right out from the box via email or text, which is the beauty of some EHR systems, is to be able to send out messages to patients that simply. That was one thing that helped to calm their fears. And also, we made sure we were lucky enough to have our office manager volunteer to work at our office by herself. I mean, it's quite a big suite, but she said she was going to lock the door and, take measures to be safe. And her house was in a remote town that doesn't have good Wi-Fi. And she has 2 small children. And she thought, I will go crazy if I try to work from home. So she has been kind enough and happy to have a job and work from the office, sort of as command central. So if a patient is having a hard time logging on, she's very, very kind and slow speaking about, don't worry, this is unusual for everyone, because sometimes the elderly people have a little bit harder time. So she's been wonderful in terms of her voice is the same as it always has been. There's no anxiety in her voice. And if all else goes wrong, we've had a couple of times where the patient just couldn't get it. I ask her for their phone number and I simply just call them and I tell them, listen, we're not going to go to jail, neither one of us, for having a phone session during this time. And sometimes it's really hard to get things on the first try. And that's the last thing I want you to worry about. The nice part is that we get to have our session regardless and touch base, because that's what our plan was for today. And so patients are always, because they don't want to seem like they couldn't do it, because they'll probably have a chance to do it again soon. As we know in psychiatry, so many of our patients have anxiety and anxiety symptoms. And absolutely, there's no doubt that since this pandemic has broken out, anxiety levels have risen dramatically. The unemployment rate is unimaginably high. Patients who, even if I reassure them that, they probably have a good chance of getting their job back, it's still very hard to not personalize that. So they're worried about insurance benefits. They're worried about their finances. If they're not used to being with their immediate family, that could be kind of tricky as well. And one of the statistics I read said that before the current pandemic, only 1 in 10 patients in the U.S. had ever used telehealth. And that was a study by J.D. Powers from July of 2019. There's no exact number of patients who've since used telehealth, but I'm quite sure that the number is growing exponentially and will continue to grow, especially since the state and the federal guidelines and laws and statutes that guide telepsychiatry and telemedicine visits have very significantly loosened up to accommodate the crisis that's currently upon us. So, for instance, there were many laws and rules around what you had to do to have a telemedicine visit. Some of them actually didn't make much sense. Like the patient couldn't be at home when you did the visit. I don't understand, unless they were housebound because of physical reasons. They had to be like away, like at college or something. So that didn't make much sense, and it sort of scared some providers away. And in fact, there were no laws whatsoever or guidelines for Connecticut in terms of how to see patients distally with telehealth until July something 2018. So think about that. We had nothing on the books for our own state in terms of any statutes or any guidelines on how to have distance visit with any patient, whether it was psychiatry or medicine, until mid 2018.
Wow.
That was just yesterday. Yeah, that was just yesterday. But I'm so pleased because the current president has mandated that Medicare is one of the insurers that must honor telemedicine or distance medicine. They don't want patients going to the emergency room unless it's absolutely necessary, which is a big driving force for putting through these statutes as quickly as possible. They even were mentioning in our own Connecticut guidelines that should you have to see a patient not with visual, but with just audio, for now, they were going to accept that. I'm not sure what will happen after the pandemic and when things get back to normal. I actually don't think that all of this will go backwards because insurance companies for the last year have been really pushing for this. Think about it. It's so much more efficient. In psychiatry in particular, it makes sense. We don't touch our patients. We don't need to do a physical hands-on exam. It may be a little harder for people in primary care because sometimes they can't, feel patients' lymph nodes if they're doing a telemed visit. But at least in psychiatry, I remember thinking everything that we do, we can do over telemedicine, right? Maintain eye contact, be reassuring, and really just be ourselves. There's nothing that we don't know already that we have to learn specifically. We might need to remind ourselves of some things. But everything that we need to know about doing a telepsychiatry visit is something that we already have done before. And that's important to know.
I think those are great points to make. And I know you touched on this a little bit already, but could you just give us the rundown in terms of what are the best apps available currently for telepsychiatry? I know that some might be overloaded right now because of internet usage and things like that, but what are the most currently used ones and sort of, price-wise and things like that? Can you also share with us some information on how to find these? And just so our listeners know, we will be including a lot of this information in the show notes because there are specific links when it comes to billing, insurance, and things like that. We'll get to a little bit later in the episode, but some of this information we'll definitely be putting in the show notes as well. So if you can kind of just touch on a little bit of this, and we'll give you more detailed information in those notes.
I have been able to vet out some, but not all. So I guess because I looked into it specifically, Zoom did, and especially because it did have HIPAA compliance, all we had to do was online sign a business associate agreement for our healthcare, for their healthcare customers. I want to say the first month was $19.99. And I hope Zoom doesn't call to, chastise me for saying the wrong amounts. But they're getting some PR, so maybe they won't. And then after that, it was $200 per month. And that was for a practice of between 2 and 10 people. And actually, the day that we had difficulty, the first day that every single student in my town started to do distance learning, and most people were working from home, there was a huge load put on our local bandwidth, and everybody was home during the day. So this was a difficult situation in terms of the connections. I asked a few providers, who were you using that day, and did you have any problems? And they were one of the companies that didn't have any problems to the few people that I spoke to. I will include in that my electronic medical records company, Cario, were extraordinarily supportive. And as soon as we got a hold of them, they literally dedicated somebody to us to make sure that it wasn't anything from their end. Because it's hard to tell sometimes if it's the patient's Wi-Fi. As you go on, you sort of get more comfortable with it. You don't have to become an IT specialist by any means. All of these companies pay very well to have IT specialists troubleshoot and be liaisons to their providers because they know we work in the healthcare field and our expertise is seeing patients. So my best advice is whichever program you choose, find out the name of the top guy or female in the IT department and befriend them, send them some flowers. No, you don't have to do that, but it would behoove you to find out their name and get their contact info in case you run into some problems. And again, even when you do run into problems, patients are completely okay with receiving a phone call. That's the best part. DoxyMe was a standalone HIPAA-compliant telemedicine platform. There was some mild connectivity issues, but again, it was during the startup days of many people working from home. A lot of the EHR all-in-one programs offer the feature of telemedicine. Again, like I said, we use Kareo EHR, Kareo. There's also Doctors on Demand, but you really have to look online for the telepsychiatry specific ones because, we do need excellent connectivity because like I can think of one patient who the visits were wonderfully concurrent. There was no lag time except for this patient who lived in New York State. And it was so difficult because I could see she couldn't understand me and I couldn't barely see her. There was such a foggy connection and that was hard. So I would definitely ask your peers. The nice part about this is typically in psychiatry, I find we're so isolated because we all go into our offices in the daytime and we're so tired at nighttime that we don't ever get to meet our local providers. And this has been, for me at least, a wonderful way to connect to some local therapists. I've just cold called them and said, hey, what insurances do you take? Have you ventured out into telemedicine yet? Are you comfortable taking a new patient? If I refer one to you, that's appropriate. And it's really been very nice to talk to them. Like I've never heard their voices before. And everybody is in a sharing mode. Sometimes, how it is in business, people don't want to share their proprietary information. I've not found that at all. I've actually given other providers a lot of patient diagnostic codes that I've added on. For instance, I'll just throw a couple out. Like V as in Victor 63.79 is basically when there's a big stressor going on in a family that's outside of their control. And I think for sure that this qualifies as such. There's also ones when people are unemployed or if they're stressed about potentially losing their jobs. So if you look up codes, there's a lot of Z codes and V as in Victor codes that you can add on to sort of justify whatever level of visit that you're doing with the patient, especially right now, because using just their primary diagnoses sometimes doesn't give the big picture. Because we are spending a lot of time doing patient education personally about the COVID virus. Here in Fairfield County, it happens to be quite virulent right now. And we're kind of tired here of staying inside. And I have to remind patients, like, have another family meeting and don't let your guard down just for 2 more weeks because it might pass us over by then. But in the meantime, you know, all the good things that you've been doing, you have to continue doing. And if anybody has a 10-year-old child in the house, because 10-year-olds are amazing rule followers, like give them a Lysol wipe and tell them every night you're going to Lysol wipe all the handles in the kitchen, you know, and you can just guarantee that they'll do it because I love 10-year-olds. They just follow the rules. They don't ask why. They just are like happy to do it. You know, don't ask a 16-year-old because they'll probably cough on them instead just to be, you know, and it really is kind of funny because all the patients I talk to, it really is developmentally interesting what they're telling their children and which children don't care and which children, you know, the teenagers want to go hang out with their boyfriends. And that's really hard. I personally have 5 young adults home. 3 are my own, 3 are my fiance's. And they're struggling with not being able to graduate this year because 3 were seniors. And so, figuring out how to reframe. I love the term reframing things. It's a great skill. Hey, we're not going to be able to do graduation at your schools, but we're going to have a blast of a party with the dogs in the backyard. We're going to get caps and gowns from Amazon, and I am going to make a commencement speech. And of course, they were so excited about that. No, actually, they rolled their eyes. But I think that was about the commencement speech because they knew it would be very long and winded. But I think it is great. And honestly, if anybody needs to, you go on Amazon for $25. You have a cap and gown. Because there's a lot of kids graduating high school or kindergarten, and that is something that they do look forward to. So, and trying to make some different changes. If now is the time in your life where you can step out of your comfort zone with your family, why not try it? My daughter wanted to play Yahtzee with me the other day. I don't like Yahtzee. I like Scrabble, but I wasn't whiny. I was very mature. And I said, yeah, fine, let's play Yahtzee. And of course I did get Yahtzee, which is fun because then you get to yell Yahtzee. And it was a good time. She rolled her eyes, but that's what she does just because she loves me. And it really can make for an interesting time. Like, just trying to make some fun out of it. The dogs and
trying new things.
Absolutely. If anyone has a dog, your dogs are completely spoiled right now. I know it, and that's just fine. Yeah, the dogs are so happy to have they think like their entire pack is with them, and they're alphas, and like it's fun all day. Anyway, all right. I digressed. I'm sorry.
No, but those are great points that you made. I love that. Thank you for sharing that.
Of course.
So, if you were to talk someone through the steps of transitioning to telepsychiatry, say this is someone who has never done this before.
Yes.
What would that look like, especially at this time? What would that look like?
Okay, so what I would first recommend is get on your local state Department of Health website, because there's undoubtedly recommendations that they've recently passed, like I mentioned earlier, in Connecticut, or in general, this was a federal law that the president passed that Medicare is going to accept across the board patients doing telemedicine visits. The same with Medicaid in Connecticut. So find out first from your local Department of Health if there are still restrictions. Maybe they haven't been hit as hard and they haven't caught up to the states that have been hit terribly hard. Find out what the laws and the restrictions are, and then honestly, go through what you need. If you're a small practice and it's just you, DoxyMe might be perfect. I think it's $35 a month. It's very inexpensive because a lot of therapists, don't need the entire electronic medical record system. So, and actually, I read the state was telling Connecticut for now, and this may or may not carry forward, they were allowing people to use FaceTime, which I was shocked about.
Oh, wow.
Because typically it's not HIPAA compliant. And of course you have to check with your own state. But I was so shocked by that. It says the bill also waived any regulations that originally required that telehealth services be provided from a provider's licensed facility. So I think I mentioned before, it used to be that if you did telemedicine, you needed to do it from your office or from the hospital that you worked at. And that is no longer the case. Oh, so here it is. It says notifications encourage providers to notify patients that third-party applications such as FaceTime, Facebook Messenger video chat, Google Hangouts video, or Skype were acceptable to provide telehealth without risk that the Office of Civil Rights might seek to impose a penalty for noncompliance with HIPAA. And right, because they said this is a national emergency and they would not fine you if bottom line comes and you have to Skype or do whatever your patient knows how to do, right? Facebook Messenger is quite easy. The ones that they said that are not acceptable are Facebook Live,
I think that's probably because that is more of like a public domain.
Oh, okay.
That
Gotcha.
you would be going live to probably an audience.
Oh, no good.
Unless you were able to create like a private group, it would just be you and your patient. So that would be a little bit.
That makes sense.
Yeah.
But the three that they list, which makes me laugh, are Facebook Live, Twitch, and TikTok.
Yeah.
So don't use those three. Those are not good. But they are, for now, letting people waive the strict HIPAA rules if you do need to see your patients. And I'm telling you, if you work in psychiatry, you most likely need to see your patients. They are so comforted to see that they can contact. I give some patients my personal cell. My office manager has an office cell phone. So if patients don't want to go through the landline prompts, if they don't want to deal with that and they would like to just text her or call her on the office cell, they can. Honestly, I always say that office managers are part of the treatment team. They're so invested in speaking to the same person all the time. And I know with my office manager, they're just, and my son also works part-time at my office. If he's not there, they're just like wondering, where is he? Because they're part of the clinical team in a very different way. Yeah, they really add in their own ways.
This podcast was brought to you by NEI's Master Psychopharmacology program. This is an NEI member benefit that is designed to help you develop proficiency in the practice of psychopharmacology. Start your program today. For additional information, see the link in the podcast description.